we're here with Dr. Khan here in Manteca, and we're going to have a little conversation about stress. Hello, Dr. Khan.
Hi.
Can you please give a clinical definition of stress and how it affects the human body?
Stress is a condition where a person loses his comfort level and it becomes very irritated with the surroundings. The clinical definition is hard because in every different aspect, stress can mean different things. Usually it affects the human body by allowing an increase wearing down of the body, psychologically, leading to depression, leading to other factors.
Okay, thank you. I read that suicide can be a result of stressful work conditions. Is this to say that stress and depression may be closely related, and can stress lead to depression?
Sure. Stress is a condition where if it stays around too long, unable to solve it, you pent up things inside, you keep them too long, it leads to depression. Depression for many years, many months, can lead to a tendency to become introverted, and in some instances, patients will make a poor decision and commit suicide for that.
How would you treat someone who's overcome with stress and they just can't handle a situation on their own?
The best situation is to seek professional care, whether it's from a counselor, a psychiatrist, or the primary doctor. They will get counseling. Group counseling is important, and medications, they work very well.
Medications work well, okay. What are some other reasonable methods to treating stress, that aren't maybe medical ways?
The most important way is if you find reasons to have stress, if it's from a work environment, you need to be removed from that work environment. Some people, because of the way the job market is now, they try to cope with the stress. The stress makes the job performance become poor. When you take medications, it alleviates some of the stress, the job performance improves, and that is a great way to stay in the workplace. But in essence, it still stresses the body, decreases the lifestyle of your surroundings, and will lead to a decrease in your life. So in the end of the day, the discussion is to remove that person out of the stressful environment. That's probably the ultimate way of getting rid of the stress.
If a person couldn't leave their place of employment, is there something like a longer vacation, a massage, is there yoga, is there other things like that help, or does that really not eliminate it altogether?
Things like a massage, things like yoga, those things border more biofeedback, self-help type of things. They do work, and they work very well, but a person has to have done that in other forms of their life for it to work. They must understand the reasons of yoga, how to relax from yoga. It will work in that instance. Otherwise, it's very difficult.
Okay. Can stress alter a person's personality?
Definitely. Patients' personalities will change from stress alone. The stress leads to depression, which will alter it even further. Anxiety, they become more introverted. They don't communicate with people. That also makes them very irritable. The personality continues to change as time goes on until they become a very aggressive personality, lead to the quote-unquote meanness that occurs. And unless they seek medical help or medication or counseling, it continues to progress. To a point where there's a disruption in relationships, family, and they become quote-unquote disowned.
Are some people just wired to be more sensitive to stress and more affected by it?
Sure. There's some people that have more stress, type A personalities. They find more stress in themselves. They pinpoint things. Some people can have inherited psychological disorders, and those are personality disorders fall into that category. Mania, bipolar disorders, those things are what we call wired people. They're genetically made that way, and they will have more stress. And those people require more help to get rid of them.
Okay. Can stress take off years of a person's life?
It takes off years of a person's life by allowing them to continuously revisit stressful situations, and that continuity does take off life. It causes a decrease in happiness, and that's directly correlated with decrease in lifestyle and life. The stressful situation causes medical changes in the body, which will lead to heart attacks to occur, higher blood pressure, those type of things to happen. that person could be driving down the street and because he's so stressed, he's thinking of different things and has an accident, dies. There's just a lot of things.
Mm-hmm. Is there a way to eliminate stress altogether from somebody's life, or is it just unavoidable in most cases?
I think that alleviate person's stress from their life altogether is either they change their lifestyle, their pattern of lifestyle. Counseling really helps with that portion of it. Medications assist with that. But these stressful situations, one needs to recognize what it is, remove themselves from that situation. If they need treatment, remove themselves and get treatment. That is about the only way that can happen.
Okay. All right. Well, thank you for your time. And that is our conversation on stress.